AIDS and drug addiction are two topics that are very interconnected that both hold a lot of negative stigma. Because of this negative stigma, especially in the United States, both of these illnesses lack effective treatments. One treatment, known as needle exchange programs, that has become more popular recently, targets the connection between injection drug use and the spread of HIV. Now, this topic is very controversial, and because of this, it is likely that it will pop up on ballots in upcoming elections. So I'm going to tell you more about what needle exchange programs are, their overall benefit, and why they're so controversial, so you all can become educated voters on this topic. Now, in my hometown, in the past year, 10 new cases of HIV popped up, and they were all directly linked to the increased use of injection drugs. So, as someone who has seen that connection and understands the benefits that needle exchange programs can have on preventing that connection, I will be voting in favor of needle exchange programs on upcoming ballots, and I urge you all to do the same. So needle exchange programs are places where drug users can go to deposit and dispose safely of used syringes and obtain free, clean, sterile syringes without any judgment. The 2001 International Journal of Drug Policy article written by Susan Sherman entitled Point Defiance identified injection drug use as the second leading factor for the spread of HIV in the United States. So if we look at this chart, it's a little confusing because the two biggest chunks are male-to-male and male-to-female sexual contact, but in this article it was put together. But 8% of all HIV cases are directly caused from injection drug use. So long-term research has shown that needle exchange programs successfully target the spread of HIV by preventing it with dirty needles. A 2016 Center for Disease Control article entitled Access to Clean Syringes reviewed 15 studies that were done on the effect of implementing needle exchange programs on the transmission of HIV in New York City. Over the course of 15 years, the prevalence of HIV in the overall population decreased from a staggering 50% to only 17%. This is because with NEPs prevent dirty needles from being exchanged and therefore prevent the transfer of the bloodborne illnesses through the needles. These results are also been reflected on larger scales in other countries such as Canada and Switzerland that have been implementing these programs for much longer. Now, if we look at this issue from an economic standpoint, we can also see the favor of needle exchange programs. One case of HIV in the United States costs about $20,000 a year to treat. A cost-benefit analysis study shows that if the United States were to spend $1 million annually on implementing nationwide needle exchange programs, they would ultimately save about $75.8 million each year simply because of the reduced number of HIV patients. So if we look at this in a smaller perspective, we can see that for every $1 that the United States would spend towards needle exchange programs, they would earn back $7.58. These economic benefits, like the previous health benefits mentioned, have also been seen reflected on larger scales in other countries. But because of the high negative stigma that surrounds illegal drug use in the United States, political and ideological controversy has swarmed this issue and prevented these benefits from being seen in the United States. The U.S. is notorious worldwide for its aggressive attacks against illegal drug use and their users. A 2017 American Medical Association article titled Needle Exchange Program Status in the United States outlines the U.S. government's fear that if they federally fund needle exchange programs, they will undercut law enforcement's war on drugs, and they could signal an approval of illegal drug use. Now, this is a fair argument to make. How can we aid drug users? How can we literally give them a needle to stick in their arm and then continue to prosecute their actions? The answer lies in the fact that needle exchange programs are not an approval of illegal drug use. They are a disapproval of something much worse, which is the spread of deadly, uncurable bloodborne illnesses such as HIV. Needle exchange programs protect users and non-users alike by preventing the transmission and reception of HIV. Another fear that the U.S. government holds about funding needle exchange programs federally is that they remove an obstacle to what they call safe drug use. Now, this is another fair argument to be made, but it is made by those that don't understand what addiction really is. They view it as a choice, not a disease. The 2020 American Addiction Center article, written by Dr. Amanda Lautieri, entitled Drug Addiction and Disease, medically defines addiction as a disease because it continues to alter the brain's capabilities to make decisions long after drug use has stopped. A 2020 Science Direct article, written by Jennifer Siverstein, entitled Syringe Access and Health Harms, outlines a case study that was done in California's Central Coast on the opinions of drug users on needle exchange programs. One user, Jimmy, he was quoted when referring to hepatitis as saying, "Pretty much everybody I know has it. But they don't care, because like I said, are you going to risk being sick or are you going to get high?" This first-hand account illustrates how altered the decision-making process is by the use of drugs. Because the brain gets rewired and is unable to count risk analysis properly, the desire to get high outweighs any natural instincts for self-preservation. That being said, the same users who were interviewed also said that if they had access to needle exchange programs, they would use them. They wouldn't choose to make these risky choices. They wouldn't choose to put themselves and others at risk for receiving deadly, uncurable diseases if they didn't have to, if they felt they had another choice. Needle exchange programs are this other choice. They can severely reduce the spread of HIV in the United States, and in doing so, save hundreds of thousands of dollars yearly in healthcare costs. The stigma that is currently surrounding drug use has hindered the implementation of needle exchange programs thus far, but as both the problems of drug use and HIV have worsened in the last couple of decades, we have seen small steps moving in favor of implementing needle exchange programs. In order for real solid change to be made, we need educated voters to vote in favor of what will benefit the most people. I hope that after learning about the benefits of needle exchange programs, you guys can continue to view this issue without negative stigma, and you will become those voters that can make a change. Thank you.